Go.
Okay, so before I begin the catheterization process, I would have to do an assessment on my patient. For today's purposes, I'm just going to verbalize that. So I have to assess the patient's overall condition and also their ability to cooperate throughout the procedure until they still. Also their ability to remain supine throughout the procedure. And then I also verify my physician's orders that this patient needs a catheter, what size catheter to use, and things of that sort. I would also assess the patient's last time they voided or the last time they were catheterized. Next, I'm just going to make sure I have all of my supplies. I have my hand hygiene, my tape, and then my kit, my sterile catheterization kit that has my gloves and everything else that I need. So upon entering the room, I would introduce myself to the patient. I would say, hi, I'm Emily, I'm going to be your student nurse today. And then I would verify my patient's name and their date of birth with their wristband and that the records that I have that they match up. Also verify any allergies. Before I begin, I'm just going to go ahead and provide patient privacy and raise the bed to waist height. The table that I'm working at today is not exactly waist height, but I would ideally want a waist height workspace in the clinical setting. Then I'm going to go ahead and explain the procedure to the patient, just letting them know that I'm placing an indwelling catheter, that they're having difficulty voiding, and that this will help to drain their bladder. I will also just let them know that to cooperate, I'll need them to lay still on their back, and that it may be just slightly uncomfortable, but it'll be a quick procedure, and they'll feel a lot better once it is finished. I would also assess the patient for bladder distension and fullness, which would indicate them needing that catheter. When I entered the room, I should have performed hand hygiene. So I'll do that now. Okay, so now that I've explained the procedure, I've let them know what they can do to help me. I'm going to position them into the best position to place the catheter. I have a female patient today, so I will need her to lay supine with her knees flexed, her feet about 2 feet apart, and that her hips are rotated out just slightly. Now that she is positioned properly, I would clean the perineal area if there was any gross contamination, but my patient today does nothing of that. So I'm going to start by opening my catheterization kit. I'll open the bag and take out my kit. I'm going to open this plastic bag to put my trash in. Okay. So to open this sterilely, I'm going to open it with the top flap first. I will then open the sides. Push that up a little bit. And then I'm going to take my bottom flap back towards me. Okay. So I'm going to go ahead and perform hand hygiene again before I touch any of this stuff. I'm going to place the drape first and then don my sterile gloves. So I'm going to grab my sterile drape to place under my patient. Trying not to cross over, but again, my table's not at waist height, so it is a little bit difficult not to. And then I'm going to open this, the shiny side towards me, touching just the outer 1-inch border, so that I can place this without crossing over. So then I'm going to place that, and I'm going to position my patient as if their hips were under or over top of the drape. In the clinical setting, it may help to have another nurse to help me do this. Next, I'm going to get rid of this drape because I will not be using this today. And then I'm going to grab my exam gloves out of here and I will be putting those on. So I'm going to start by opening the package. Lay my flap down. And opening the gloves, all just touching the outer border. So I'm going to glove my dominant hand first. I'm going to pick my glove up and step back and insert my hand into the glove without contaminating it. Okay. And then I am going to glove my non-dominant hand before fixing this other glove. So I'm going to grab underneath the cuff and step back, trying to keep my hands, again, above waist height, but with my working space, it's a little bit difficult. Okay, so I have that glove on, and since this hand is now sterile, I can fix my fingers in the glove. Okay, so now that my hands are sterile, I'm going to keep them above my waist, and I'm going to then take my catheter kit. I'm going to take my tray, and I'm going to first take out my forceps. I'm going to set these still on the sterile field, just out of my way a little bit. And I'm going to squeeze my antiseptic solution onto my cotton balls, and then I will throw that away. I will take my lubricant and open that into the tray and discard that as well. I will then take my syringe, take my cap off, and I will connect this to the proper placement on the catheter tubing. And then I will take my catheter tip and lubricate that and just rest it in the tray, keeping it sterile still. Okay. One thing I'd like to note is when I was putting my sterile gloves on, it's important that you keep your sterile field in view, and that was. I just wanted to note that before moving on. Okay, so to clean the perineal area before catheterization, I'm going to take my forceps and my cotton balls with my antiseptic solution. I'm going to take my non-dominant hand and spread the labia majora, and I'm going to clean top to bottom, and then I will discard this without crossing over my sterile field. I will then get a new cotton ball, and I will clean top to bottom. On that last cotton ball, I feel like it may have touched the tip of my finger, and since this hand is considered contaminated, I would have to start the process over or get a new cotton ball for that side. But also just wanted to note that. I'm then going to take another cotton ball and clean down the middle, top to bottom. And then using one circular motion without crossing over, I'm just going to clean a circular motion around the meatus. And then I will toss the forceps and the cotton ball. Now that the perineal area is clean, I'll take my sterile hand and grab my catheter tip 2 to 3 inches from the tip itself. I will ask my patient to take a deep breath, and then I will just insert that catheter. Getting a little bit of resistance from my box. Okay, so I'm going to pause for a second, and I'm going to put this back into my sterile container. In the clinical setting, obviously, I would have to start over with a new catheter. I just have to realign. For some reason, my sponge isn't lining up with the hole. Okay, so obviously, I would have to keep that in place, and these touch, so it would no longer be sterile. But I know that I have to keep my non-dominant hand in the same position to keep from contaminating. And this hand theoretically is contaminated, but for the purposes of the video, I'm going to keep it. I'm going to keep going. I'm going to start that over. Pretend that everything is still sterile. And again, grab my catheter 2 inches from the tip, and hope that I can find my hole again. Okay, I found my hole now. And I would like to note that this hand touched the meatus itself, so it would be contaminated. But I would try my best not to, but finding that hole was a little bit difficult. Once I find the hole, I'm going to advance the catheter into the urethra until I see urine in the tubing. Once I see that, I'm going to advance it 1 to 2 inches further. After that, I'm going to take my sterile hand and insert my fluid to inflate my balloon. Okay, and I can disconnect that from my tubing and throw that away as well. To check the placement, I'm going to just give a little tug on my catheter. That tells me that the balloon is inflated and it is in place. If my patient complained of any pain during this or after that was placed, I would withdraw the solution, advance the catheter, and then try to inflate the balloon again. Now that that is in place, I would then tape my catheter in place. In the clinical setting, I would take the catheter tubing, take a little slack, and I would use the tape that I have here to tape it into place on the patient's inner thigh because it's a female patient. For the purposes today, I'm just going to verbalize that as I don't have anything good to tape it to. Also, I'm going to take the collection bag and I would place this on a non-movable part of the bed below the bladder level. I'm just going to set it on a surface I have down here for the purposes of this video, and then I would ensure that there was no kinks or anything in the tubing. Now that I have that done, I can go ahead and discard of my supplies. I can take this drape out from underneath my patient and discard of my gloves. Actually, before I discard of the supplies and the gloves, I would have to remove any excess antiseptic solution or the lubricant from the perineal area, and then take my gloves off and discard my supplies. I will then perform hand hygiene and I would lower the bed back down to the safe level and return my patient to a comfortable position. I could then document the procedure, let them, or document in the system that I placed the catheter size, the volume of urine that was collected, and the color and the clarity of that, and how the patient tolerated the procedure. After that is finished, I would be done. I would like to note that I believe I forgot to do hand hygiene before putting on my exam gloves, and that would be important after I open that kit, perform hand hygiene, and then put on my gloves. But other than that, I think I'm finished.